All right. Hello, beautiful people. It has been a moment since I've been on, especially since IG has restricted my account because I was showing my belly and said that was a risk factor for eating disorders. Anything to censor the truth, IG, anything to censor the truth. So today I'm coming on live to talk about something that I see very commonly, not only in my practice here in clinic, but also I see as an anesthesiologist when I take care of patients for their procedures or for their surgeries. And it is a big deal because what I promote here is for people to not just wait when things are going downhill, because that's a bigger hill to climb back up. It's you want to catch it before it gets there so that you're not having a harder time getting your body back into balance. And what I'm talking about is when you have a chronic health condition, when you've been diagnosed with one, things like hypertension, things like diabetes, whether it's weight gain, hormonal imbalances, and you're needing more than one medication to control it, it's probably not addressing the root cause. That's one. But two, these drugs are not identical with our bodies, like bioidentical with the natural state of our bodies. So they're not meant to be taken long term. And you can see that evidence in the data out there that shows things about polypharmacy, right? Increased risk of mortality, which is death rate, 30%. Whoa, that's high. More than five, it goes even more. That is high. And yes, we're saying polypharmacy is more than five medications. This is what I talk about. I'm not waiting to get to five. You need to check yourself when you're going more than one to treat one thing that you have going on. That's an issue, okay? Because something else needs to change, especially when what is being addressed are chronic health conditions that are related to things that can be caused by lifestyle issues, that can be caused by nutrition. And I will talk a little bit more about this because, specifically with hypertension and diabetes, there's more to that. I have people that are doing wonderful things with their lifestyle and nutrition and still have this going on because there's more to it. Okay. But we don't want to wait. And then these synthetic drugs were not meant for us to take long term. But one of the biggest things I see with my people that come into my clinic, and even when I talk to them during anesthesia, why they don't want to take some of these medications, it's that it also has side effects that hit their mental health. Come on, when your mental health is hit, you can't even make good decisions in life anymore. You can't handle your relationships. Okay, that's a big deal. And then sexual function. And I'm not talking just erectile dysfunction, lower testosterone. I'm talking about even for women. This comes up. You can go Google. We see that happening with hypertensive medications like beta blockers. Okay, all the metoprolol and all the olol names. We see that with the water pill HCTZ. Okay, that it can have an effect on your sexual function. Metformin, commonly known for diabetes, yes, it can. Yes, it can. But I always tell people listen to your body. There are multiple side effects for a lot of these synthetic drugs. And some people are not going to have those side effects, and some will. But I'm telling you, if you're not having some of these side effects when you're on something long term, it might also be a red flag because your body might just not be sensitive enough to pick on it. It's one of the gift for sensitive people. They're sensitive to just a minute thing of, whatever their body just goes, "Wow!" But guess what? They're going to prevent themselves from hitting that chronic health condition that people are having too. Okay. And so this is what I wanted to harp on. If there's nothing else you gain from this video, is that if you're starting to need more than one medication for what you're going through, it's time to start looking at the root cause. It's time to start looking at things more naturally and holistically that are more compatible with your body, whether it's your nutrition, your lifestyle, but especially some of the bioresonance energy frequency healing that I now use in my practice. We are energetic beings. I mean, go get an EKG, check your heart rate, the blip, blip, electromagnetic. Okay, we are electromagnetic beings. And these frequencies are frequencies that are already within our body. That's why they are bioresonance. Bioresonance. So they work so well for the body, getting the body more into an optimal state versus synthetic things that we can see the data showing that it increases risk of death, amongst other things, right? Including the side effects that you get more medications for the new side effects. And before you know it, voila, you are on multiple medications. It happens like this, okay? And in 2025, with all the information we have out there, overload of information we have out there, we need to be able to make those changes now. So, another thing I wanted to talk about with these, especially hypertension and diabetes, okay? If you're already at the point where you're having some of these side effects, especially with your libido, energy, mental health, start seeking help. Don't wait because, different things could be happening. Some of these things are trying to shut down, reduce blood flow because your blood pressure is high. But then it's reducing blood flow to other vital organs because the issue is not the high blood flow. The issue is what is causing that high blood pressure, right? And so, other causes of things like hypertension and diabetes, outside of the usual lifestyle, which you want to make sure you're not just sedentary, you're moving, you're breathing, you're handling your stress, your nutrition, okay, reducing processed foods, reducing the sugars. Yes, especially when you're diabetic, high sugar fruits also are an issue, okay? But less common things that cause things with hypertension and diabetes: environmental toxins, the pollution in the air, heavy metal exposures. Go right now and Google things like heavy metal and things like obesity, heavy metal and diabetes, and see what pops up. Heavy metals and autoimmune conditions, and see what pops up. All research behind all of that, right? And then we have things like root canals, okay? Yes, root canals, infections in the teeth can cause things with diabetes and hypertension. Yes, sir. Yes, ma'am. Parasites, yeast, candida that will keep your blood sugar going. These things can actually invade your pancreas. And in 2025, post pandemic, I've seen people after they've caught this bug out there, sometimes misdiagnosed as something else, end up with diabetes and hypertension, including other things like cancers that are now showing up. But yes, that also can tweak your system so that your system is not as optimal as it needs to be, and your body's basically screaming, and then you're being diagnosed with these things now. Okay, stress. Stress is a big deal whenever it comes to hypertension and diabetes. I have seen people that are fit runners drop dead with a heart attack. Okay, I have seen people that are fit, eating healthy, still with diabetes, because stress is a big deal. It could be acute stress that you're going on with, it could be chronic stress, and what I call latent stress. Latent meaning something that happened to you years ago, childhood times, even in utero, but it skewed your nervous system to be wired in stress, and then it burns out. And you think that's your norm, but it really isn't. Basically, it's just stressed your body out to the point where you're young, but you start experiencing all these diseases that are just a byproduct of your nervous system breaking down. So all these things are very important. Okay, and then just your organs degenerating in general, right? That's why when I do my scans, I'm looking at the pancreas, I'm looking at the liver, I'm looking at the kidneys, I'm looking at the adrenals. I mean, I've seen adrenal issues alone cause blood pressure problems. And again, I see this with my scans, and the blood work results are normal. We work on what the scans are showing, and people get better. We're in the age of frequency and energy. It was a time where they said the future was that. Well, we're here. And we need to move that way with the way we address these things, because it can prevent so many more issues down the line. All right. And so, main thing, it is time for you to start addressing the root cause with things that are more natural to your body. If you're starting to need more than one medication for whatever it is you're dealing with, especially hypertension and diabetes. Okay. And if anyone has any questions, any concerns, you need a little bit more insight, you can always go to EzLivingMD.com, request a free phone consultation, and we will go from there. It's just 15 minutes, people. 15 minutes, okay, of your time, just to point you in the right direction. All right, have a wonderful, blessed day. One love. Ashe, Ise.